The challenge for Medicare is to keep the program alive while also keeping aging patients alive. 47 million Americans are on Medicare at a cost of $468 billion, about 13% of the federal budget. Barbara Hayes is on Medicare. She's dying of colon cancer.
I could have 6 days, I could have 6 months, I don't know.
For her recent chemotherapy, Medicare was billed $155,000.
If I didn't have Medicare, I'd be up the creek.
But Medicare is also up a creek. In the next 10 years, as baby boomers age, 14 million more seniors will pour into the program. By 2020, Medicare spending is expected to be $1 trillion, 2/3 of today's federal budget deficit.
Essentially, Medicare is the primary driver of all the fiscal problems we face in the United States.
So the deficit panel offers some tough choices. First, people on Medicare will likely have to pay more. Right now, about 90% of beneficiaries pay virtually nothing for Medicare services. Under the panel's proposal, everyone would pay at least a $500 deductible and up to $1,650 in out-of-pocket expenses each year.
In this case, by asking people to pay more, they will end up using less, and that will reduce the total spending in the Medicare program.
Secondly, Medicare will no longer reimburse doctors and hospitals for patients who don't pay their out-of-pocket expenses. Healthcare providers will either have to go after the patient or eat the cost. Accepting these two choices would save an estimated $133 billion by 2020, 9% of today's deficit. Ben Tracy, CBS News, Los Angeles.